We want to escort our patient in. As you'll notice, the room is completely set up. You want to explain the procedure to the patient. So Ms. Madonna, we're going to take impressions of your upper and lower. You want to begin by trying in the mandibular tray first, which is more comfortable for the patient. Please raise your tongue and relax your tongue. Okay. Then you want to try in the upper. Ask your patient to please breathe through their nose. And breathe through your nose. Open a little bit. Very good. For the mandibular, I am going to use 2 scoops of Alginate and 2 scoops of the water. Very important. The ratio is 50-50. And as far as the first thing you want to do is merge all the powder before you start stropping. Stropping is going left to right, rotating your palm. It should take less than a minute. And you have this smooth mix. Once you have your mix, you want to gather it all up and leave it. You're going to divide it in half. Take half, load our mandibular tray from the lingual. We're not going to rub it around. You can smash it. And you're going to get the other part. Then you're going to get everything else out the bowl. And you're going to also load that from the lingual. You're going to put a little extra on the occlusal surface just to control any moisture. Please open. You're just going to wipe your occlusals. Don't, go back and forth. Just rub it one time. Get your tray. Raise your tongue. You want to grab the patient's cheek and lips. Lower your tongue. Be sure you get their lip from there. You're going to hold the mandibular tray in, standing at the side of the patient with 2 fingers or 1 finger on each side. You just, once it's seated, just hold it in place. Your patient is salivating. It's okay to take your saliva ejector. Thank you. Okay, and then you can check, make sure it's set. And once it is set, you may rock it out. And you'll notice on the patient impression, you have the vestibule area and you have all of the teeth. You want to wrap it in a wet paper towel and sit it to the side. Open a little bit. Go ahead and take a little water, put it on a 2x2, and wipe your patient's face. And our patient is ticklish this morning. That's all right. We love happy. Now we're going to take her maxillary. Now for the maxillary, it is 3 to 3, but if your tray is small because your patient has a smaller mouth, go ahead and use 2 scoops instead of 3. So again, on the mixing technique, you want to merge the powder. And before you start stropping, take the spatula all the way to the bottom. Once you have all of it merged, then you may strop. Once you've done that, gather it all up. Strop it a couple of times. For the maxillary, you gather everything up and you load it 1 increment, the posterior part of the tray. Then for the excess, I'll have my assistant hold that. You can take a little water and rub the impression. As I rub it, I take a little bit from the posterior area. Now when you load the tray, you put it in, you will seat the posterior then the anterior in one motion. Ms. Magana, please breathe through your nose. Breathe through your nose. Open a little wider. You want to move her lips so you can see. You want to put the handle midline. You want to grab her cheeks and make sure her lip is over the tray. Chin to your chest, Miss Magana. You're going to stand in this position. You want to check if it's ready. You can just raise up her lip, check under here in the vestibule area. Okay. And then when you take it out, you also rock it. I'm going to remove it. Okay. And then we're going to clean up her face. Would you like to rinse, Miss Magana? So we'll have her rinse at the sink. Okay, Miss Magana, so we took our alginates today. Doctor would like us to make a custom tray. Edith will walk you out, and we'll get your next visit. You have any questions? All right, great.